Hi, this is Philip Pador, founder of NTLEX RN 45-Day Challenge. In this video, I'm going to be talking about osteoarthritis. Osteo means bones, and arth refers to arthron, which means joint, and it means inflammations. So osteoarthritis is a disease involving inflammations of the bone and joint cartilage. It was once thought that it's a part of the osteoarthritis was a misnomer and that inflammation didn't play a role in its development, and that it was a mostly degenerative disease resulting from a simple wear and tear. Nowadays, it's thought that inflammation does indeed play an important role in the development of osteoarthritis. Alright? So healthy joint consists of two bones, each of which its own layer of articular cartilage, which is a type of connective tissues that allows two bones to glide against each other, essentially without the friction. With osteoarthritis, we're really talking about one particular kind of joint, which is the synovial fluid. Along with articular cartilage, another important component of the synovial joint and where they get their name from is the synovium, which along the surface of the articular cartilage forms the inner linings of the joint space. The synovial is composed of loose connective tissues, blood vessels, lymphatic vessels, and on the surface type A cells that clear the cellular debris and type B cells that produces components of the synovial fluids, which helps lubricate the two articular surfaces. One of the main issues in the osteoarthritis is the progressive loss of the articular cartilage, which means that there's not much separating the two bones anymore, which adds a significant amount of the frictions between them, which generates the inflammations and triggers pain through the nerve endings in the joint spaces. Maintaining healthy articular cartilage is the chondrocyte's job, a specialized cell responsible for maintaining every cartilage related. The chondrocytes produce and are embedded with the strong gel or extracellular matrix, which contains type 2 collagen, a protein that provides structural support, as well as the proteoglycans, which are aggregates of the protein and sugar molecules like hyaluronic acid, chondroitic sulfate, and carotenoid sulfate. All of these extracellular components give the cartilage elasticity and high tensile strength, which help weight-bearing joints distribute weight such that underlying bones absorbs the stack in the weight. And these are the joints like the knees and the hips and the lower lumbar spine. Okay, so chondrocytes are important for the articular cartilage. In healthy people, chondrocytes maintain a delicate balance between breaking down old cartilage, producing new cartilage called anabolic activity. Due to the use of the degradative enzymes and synthetic enzymes, something causes an increased expression of the degradative enzymes. Then the balance tips toward a net loss of cartilage via the loss of the proteoglycans collagens. The biggest risk factors for the osteoarthritis seems to be the age, and often the cartilage degrades over a long period of time, which makes them really hard to pinpoint one single culprit. As I mentioned earlier, inflammation seems to be involved. And there are a number of pro-inflammatory cytokines like interleukin-1, interleukin-6, tumor necrosis factors, among others that seems to play a role. Some of these are more involved in breaking down cartilage through the proteolysis, meaning increased catabolism, whereas others are more involved in blocking the formations of the new cartilage, meaning decreased anabolism. Also, joint injury, which brings with a lot of inflammations, seems to be a major risk factors for osteoarthritis, as well as the mechanical stress and obesity. Other risk factors include neurologic disorders, genetic factors, and even certain medications, suggesting that there are other mechanisms at play as well. Whatever the initial cause of the articular cartilage damage, it gets the chondrocytes to start trying to repair the cartilage. They initially start making less and more type 2 collagens, but soon switch over a different collagen type 1 collagen. Unfortunately, type 1 collagens doesn't interact with the proteoglycans in the same way, and there is an overall decrease in elasticity in the cartilage matrix, allowing it to break down Eventually, though, over the course of years, chondrocytes aren't able to keep up and they become exhausted. And they can undergo apoptosis, a programmed cell death. A cartilage gets softer, weaker, and continues to lose elasticity, and it starts to flake off in the synovial fluid space called joint mice. As type A cells in the synovium attempt to remove the debris, immune cells like lymphocytes and macrophages are recruited into the synovial membrane. Fibrillations form. Essentially, these cracks are cleft on what used to be the smooth articular surface. We call the synovitis. Fibrillations form. Essentially, these cracks are cleft on what used to be the smooth articular surface. The cartilage continues to erode away until the bone is exposed, allowing it to rub with the other bones, which causes bone aberrations, making it look like polished ivory. Finally, on the edges, bone grows outward called osteophytes, which makes the joints look wider. Something that's most obvious when it seems that the distal and the proximal interphalangeal joints, or the finger joints, called hybridine nodes in the distal joints and butchard nodes in the proximal joints. Osteoarthritis is really common and nearly everyone knows someone that suffers from it. People with osteoarthritis often feel stiffness in the morning, which usually lasts less than an hour but comes back at the end of the day. This is an important difference between the rheumatoid arthritis and inflammatory disease that also called effects of the joints. With rheumatoid arthritis, morning stiffness usually lasts longer than an hour. The pain in the osteoarthritis is usually a sharp ache or a burning sensation, which also gets worse with prolonged activity. But usually the joints don't swell, whereas the rheumatoid arthritis typically involves painful swelling. Finally, management or treatment of osteoarthritis can involve non-pharmacological approaches like losing weight or moderate exercise as well as physical therapy. This can be especially important for large weight-bearing joints like the hips and in the knees. Pharmacological treatments focus on reducing pain and inflammations. If neither of these approaches are successful, though sometimes patients might benefit from injections of the hyaluronic acid into the joint, or they might need surgery to replace the affected joints.